Hi, I'm Dr. Edwin Williams. This is a fireside chat on fat grafting. I want to talk about the controversy of fat grafting, what it is, the evolution, where does it come from, why do we use it, when do we use it. So fat grafting is not entirely new. It was done in the 90s, and I'll be honest, I was very skeptical about the efficacy, if it really worked or not. In fact, I was not a fan of it at all until the early 2000 timeframe, when some of the techniques were perfected as far as the use in facial rejuvenation. So what fat grafting is really is, and we've been doing it since 2003, have done thousands of patients. We've published on it extensively, I've written in books, textbooks. In fact, a couple of weeks ago in the Beverly Hills 2016 AAFPRS meeting, I gave a talk on fat grafting in conjunction with facelifting or facial rejuvenation surgery. So what is it? How do we harvest fat? The bottom line with fat is it doesn't have a great blood supply. And if you beat up fat, like with liposuction, the fat doesn't live. So what we do is through, typically in the tummy, or it can be from the thigh, depending, because we can always find some. And when I say that to patients, they always chuckle because everyone has a little bit. But unless someone is really, really thin, what we can do is we harvest it under low pressure from the abdomen or the thigh. And then we take the amount of fat that we harvest out under low pressure and we centrifuge it, so we separate it. And the cells that are broken and the red blood cells that are harvested in there get separated out. And the only thing that we inject back in the patient or sculpt in the patient are the viable or living cells. Now, think about it. Why do we do fat grafting? And probably 80% of the patients that I do lifting surgery on, we do fat grafting. And the reason why is this. If you think of a grape versus a raisin is nothing more than a dehydrated grape, right? Well, as we age, if you look at people in their 30s and 40s, start to look what happens to their face. The first thing that happens is their face starts to thin out. In fact, there are about 8 or 9 different fat pockets on each side of the face. For example, there's the buccal fat, there's the malar fat pad. And what happens with age is they shrink at variable rates in variable individuals. In other words, some people lose more fat in here first, and some people more in the malar fat pad. And so what we're doing, the answer isn't with a lifting procedure just to tighten things. Think about that. As we get older, if we thin out a little bit, we don't want to over-tighten the face. What we want to do is tighten the face appropriately and then sculpt or add fat where fat has been lost over time. So that's the theory behind it. Now, what do? I try to overcompensate about 5 to 10%. Knowing when the swelling goes down and what have you. But that's what gives us a very natural result. Using the fat for volume, and it's your own fat, and it's put back in a place where you've lost it. In other words, you're sculpting it. So again, get on our website, look at the patients, but basically about 80% of our patients we do either facelifting surgery or blepharoplasty where we're using fat grafting. Now, what are the issues with fat grafting? One of the things that is just a fact is that we do lose a little bit of it with time. I tell patients to expect maybe 10–15% volumetric loss per year. So in other words, after 4 or 5 or 6 years, you continue to lose volume, but that's what happens anyway when we age. So it is definitely has merit and is a rejuvenative procedure. You will hear, and I've seen this, and again, we use what we call micrografting, very, very small delivery. But you'll hear some surgeons that say, oh, I don't believe in fat grafting. And in my opinion, in my experience, it's people who don't have a lot of experience with it. If you're not doing a lot of fat grafting, you probably shouldn't be doing it. But doctors who do it and do it well get very, very consistent results. Don't get the unevenness and lumpiness, the kind of things that you hear people talking about who haven't had a lot of experience with it. So again, having done several thousand, I wouldn't do it if I didn't believe that it would really be a benefit to our patients. So I've talked a little bit about longevity. Conclusions, I think that fat grafting is here to stay. It has real merit. One of the things that we also see is it improves the condition of the skin overlying the fat grafting. So it's a rejuvenative process there as well, and really has a role in facelifting or face rejuvenation surgery. It's not perfect, but in experienced hands, it has a role in our procedure. So I just want to weigh in on fat grafting. I hope you found this chat informational.